From the Toronto Star, I'm Adrian Chung, and this matters. A miracle of modern medicine and science. This week, a COVID-19 vaccine arrives in Canada. The vaccine is real tangible hope that this is the beginning of the end of the pandemic. Canada is expected to get almost 250,000 doses of the Health Canada-approved Pfizer vaccine by the end of 2020.
There's some very, intense discussion and planning going on. The Pfizer vaccine will not come all at once. It will come in sort of regular shipments. So as you receive your first 1,000 doses, who do you give it to?
That's Canada's Deputy Chief Public Health Officer, Dr. Howard New. While it starts at the federal level, each province has its own plans on how the vaccine will be distributed. So how will Ontario's rollout work? We're talking to Rob Ferguson, provincial politics reporter for the Toronto Star, to get an idea about what we know right now and other questions like when you're likely to get your vaccine and why the province is already looking into immunity passports in 2021. Rob, hello to you at Queen's Park. Good to talk to you.
Hey, hi, Adrian.
So news about the vaccine has moved very quickly this month. Individual provinces are figuring out their rollout plans. Ontario is going with this phase plan that they have to roll out over the next year. What does that look like?
So the phase one will probably start this week once the vaccines arrive from Pfizer in Belgium. As of this point, we don't know a location. They may have been keeping that quiet for security purposes from what I've been hearing, but it will be in hospitals. Hospitals are the locations that have the super cold freezers that have to be minus 70 that are needed to keep the Pfizer vaccine in. There's 21 hospitals in Ontario that have freezers like that. And we were told in the last few days that people will have to go to the vaccine because the vaccine is not as stable as had been hoped. So aside from the fact that it's got to be kept super cold until they thaw it, mix it and inject it, they don't think it can be jostled a lot. That is what is preventing them from taking boxes of the vaccine into nursing homes to do the nursing home residents, which is desperately needed. So instead, they're going to get nursing home workers to go to whatever hospitals they pick to get their shots.
Right. So people will have to go there.
Yeah, you have to go to it. And they're saying the second vaccine that's expected to be approved from Moderna should be more transportable. And that's the one that they can take into nursing homes. Now, we don't know when that is going to be approved, maybe by the end of December, early January, and it would probably start arriving very quickly to continue this phase one. So what we know at this point is they're expecting to get very small amounts of vaccine this month, and particularly this week in the first shipment. So those will probably go to the lockdown areas, Toronto and Peel, which makes the most sense because that's where the highest community spread is. And then the more we get, the more they can branch it out. As phase one continues, it's expected to go till the end of March into April. And that across the country is to do about 3 million of the most vulnerable people. So the healthcare workers, the nursing home residents, the retirement home residents, the group home residents, maybe the jails, anywhere people are living in congregate settings where if the virus gets in, it can spread like wildfire. So only once we get to phase two, starting in April, do they get to the rest of us, like the senior citizens. They'll probably start at higher ages and then work their way down to the younger ones and, eventually get from people in their 80s down to people in their 20s and teenagers. And maybe by then we will have a vaccine approved for kids, which we don't have yet.
Right. So the vast majority of Ontarians probably will not see the vaccine until April, unless you are, again, in that high priority list of healthcare workers, people in long-term care homes, people like that.
Yes, as General Hillier, who's heading Ontario's vaccine task force, was saying, people are going to have to be patient. And just think of it, if you're a healthy adult with no underlying conditions, do you really want to be in line ahead of somebody who's 70, who's had pneumonia a lot, or, lives in a nursing home? So there's a lot of people that can wait, and I'm sure they'll get the shot when the time comes. Might not be till the summer, but it will come.
Yeah, we just got to be patient. Considering Ontario's still seeing record caseloads every day, knowing the toll the pandemic has taken, and I know we rarely get to celebrate good things covering the news, but this is really good news, right?
It's massive news. If you had asked anybody covering this or even doctors last March, when we went into lockdown around March break, if they thought we would have a vaccine this soon, there were a lot of skeptics, and rightly so, because, usually vaccines take years to develop. But, governments around the world have thrown a lot of money at vaccine manufacturers to kickstart this and develop it. There's been, this amazing new technology come out for these vaccines, and it's a pandemic and there's a lot on the line. So everything came together and it's happening. I personally did not think it would be this soon. I'm very pleased it is, because as much as anybody else, I would love to stop writing news stories every single day about COVID. I would like to write some news about something else. And, we'll eventually get there.
Obviously, the development of the vaccine has been very complex, but we are here now. The rollout, too, is also a very complex beast to make sure that it's getting, again, to high priority people, that we do this the right way. Your reporting focused, I think, on a detail, and maybe the easiest way to describe it would be a vaccination passport of sorts. Here in Ontario, can you explain that?
Yeah, this is a topic that first came up, I guess, last spring when people were thinking and wondering, okay, if they've already had COVID, do they have immunity? And would that give them more freedom, like maybe to do things or maybe not to wear a mask? But, this is all evolving. And I guess what you could say is the problem with this whole immunity passport idea, or just a simple proof of vaccination and how far it will get you, it's one of those things that sounds very simple, but it's not, because there's so many implications to it. For example, we don't know now if you get the shot, whether you can still be kind of a silent spreader of COVID, because maybe the shot prevents you from getting symptoms, but it doesn't prevent you from having like a mild case that you could still shed and spread. So the science has to catch up with that. So this is one of the many factors in, the so-called immunity passport. So we've had the Ontario government health minister, Christine Elliott, say it's something that they're looking at. I think a lot of governments are going to look at it.
It's going to be really important for people to have for travel purposes, perhaps for work purposes, for going to theaters or cinemas or any other places where people will be in closer physical contact when we get through the worst of the pandemic.
Obviously, everyone's going to want proof of immunization for the COVID vaccine, just as we have it for polio, measles, all those other infectious diseases that have been largely quelled because we have vaccines. It is likely that unless you have the vaccine, for example, once it's in wide circulation, you're probably not going to be able to work at a nursing home or a hospital, because the virus is so contagious that it's really not wise. Where it gets tricky is in terms of like human rights and the Charter of Freedoms. Can an employer require you to have the vaccine? There's debate on that, and I'm not a lawyer, you're not a lawyer, and lawyers like to argue about things and they don't always agree. So I can see a situation where certain employers where people are working in super close quarters, where we've had a lot of outbreaks, for example, like meat packing plants, it would seem to be a good idea for everyone to have the vaccination. On the other hand, some people can't get the vaccination because they have bad allergies to vaccines. And, the hope is with these vaccines, if you're allergic to one, maybe you won't be allergic to another, because there's a bunch of different COVID vaccine manufacturers. So that's going to have to be sorted out, as well as will the fact that, as I mentioned earlier, we don't have a vaccine for kids yet. The Pfizer vaccine that's coming out is not cleared for anyone under 16. So there's that.
We'll be right back. So the province is mostly just looking at it at this point because, in other contexts too, there has been talk about vaccination passports, whether it might be traveling by plane Airlines might require you to have some sort of immunization record. Ticketmaster, for instance, has talked about if you want to go attend a concert, you might have to show that you're immunized. So this is part and parcel with the things that the province is looking at.
Yeah, those things are all going to have to be considered. And I think the government wants to start a dialogue. It's going to involve businesses. It's going to involve public health experts. It's going to involve civil rights people. It's going to involve bioethicists and privacy experts, because there are some health privacy issues here too. And as well as keeping track of the evolving science. And, someone could argue, well, pregnant women, I don't think can get the shot. As we mentioned, people with allergies. And a lawyer could argue that you might have to put in alternate protection measures for people like that, such as, personal protective equipment, maintaining the distancing. And can businesses decide who to admit? Like you said, Ticketmaster or an airline. And we all know you can't go to some countries unless you have proof of a bunch of vaccinations for things like polio and yellow fever and nasty things like that. So there's a lot to be hammered out, and it's not going to be easy or simple.
The messaging from the province has been criticized this fall in the second wave. So communication is also a key part here, we have learned. What is the province doing to make sure that the vaccination message reaches as many people as possible?
They are planning a communications campaign around the vaccine. And when you think of it, it's a really good idea. Polls show like a fair number of people want to get the vaccine, but also, like we were talking earlier, it's been developed fairly rapidly. So you can watch any television newscast and see people interviewed saying, yeah, I'm not an anti-vaxxer, but I am kind of wondering.
They are hesitant.
Yeah, they're hesitant. So there is this hesitancy. So, I've talked to people, I get a lot of emails from readers, asking me, can they get COVID from the vaccine? And I'm going, well, it's not a dead molecule vaccine. It's a different kind. It triggers responses in the immune system. So, they need to explain how the vaccine was developed, how it differs from other vaccines, say what they know. And it's probably a smart thing for them to say what they don't know and what is still being determined through the active science. Like, does the vaccine make you not able to spread the virus, or could it still spread? So they need to do that. They need to get as many people on board as possible, with the experts saying we need at least 70% of people to get the vaccine so we can develop a herd immunity, so that it kind of runs its course and is minimized as much as possible.
I'm also thinking about some of the lessons that we could have learned from past situations of inoculation, vaccination. Anyone who tried to get a flu shot this fall in Ontario, especially the GTA, will know how hard it was to actually get it, because demand was so much higher than the supply, especially this year, and at least initially. Was that the dress rehearsal? Like, what did the province learn from that experience?
Yeah, I'm hoping that wasn't the dress rehearsal, because if it was, it's a problem. One of the things that happened with the flu vaccine rollout is they ordered way more vaccine than they did previous years, because they knew the uptake would be bigger. And it turned out to be even bigger than they thought. And, some pharmacies had actually booked appointments in excess of the vaccine supplies they were getting and had to cancel those appointments. So, that's like an airline overbooking for a flight. 300 people show up for 200 seats, and you've got a lot of people who are ticked off. And this isn't just a flight, it's health. So I know they did learn lessons from that. The problem is, at this point, we don't really know in detail enough about their plans to know how to circumvent that. I think, however, the COVID planning has been at a higher level because there's much more at stake. And we'll see what kind of detail we get. But it's going to have to be supremely well organized. I don't know how they're going to tell people to come in. I don't think you want to put out an open call and say anyone who works at a nursing home in Toronto in the 416 should come to Toronto General Hospital on Thursday and line up for a shot, because, you could have hundreds or thousands of people and it could be a crowd. So I think they're going to need to organize it in some fashion to keep it orderly, maybe appointments, or maybe they'll assign spots to, nursing home X and say your staff should come here between 2 and 4 on Thursday, something like that.
There are many details to be figured out here.
Yeah, on a lot of levels. Don't forget, it's not just putting shots in the arms, it's keeping records so that they know that someone's had their shot and you got to come back 3 weeks later for your booster. That's all got to be organized and coordinated for thousands and thousands and thousands of people. So that's an IT issue, that's a logistics issue, that's a scheduling issue. So it's almost like three-dimensional chess.
We're already seeing it play out in the UK. Thousands are already getting the jab. These are historic days. You're at Queen's Park. what is the mood from the government these days as we're about to roll out the vaccines?
They are relieved that the vaccine is here, but clouding that is the fact that, we've had so many record highs in cases. We're pretty much every day hitting a new record in the number of active cases, which is people diagnosed with COVID-19 in the previous 14 days who are actively either fighting the virus or have symptoms of some sort. That's above 16,000 generally. We're pushing towards a 7-day moving average of almost 2,000 people that are becoming infected each and every day. So we have the vaccine, but it's coming out in very small amounts. And the complicating factor is the hospitals. We're back to hospital levels not seen since last May, just after the really, really nasty April peak. So, hospital ICU intensive care units are getting more full. We're already at the level of over 200 ICU patients across the province with COVID that it's pinching non-emergency surgeries. So that's not just affecting people with COVID. That's, your mother who's waiting for her hip replacement, or it might be someone for a cancer surgery that's not considered urgent in the grander scheme of things. But if you've got cancer and you're awaiting surgery, to you, it's pretty urgent. So that's the type of problems we're having. We have Christmas coming up. The hospitalizations are catching up to the huge surge in cases we've had since September. The hospital numbers are going to go up. They're probably going to surpass the first wave. So we've got to get through this season, the rest of December, January, February, and into March, when there are traditionally way more demands on the healthcare system than there are in the better weather. So we are by no means out of the woods, and things could still get pretty tricky, even as the vaccine starts to make a dent.
This is a bright light, of course, but the situation is very, very serious here in Ontario.
Yeah, it's like you've got a really nice morsel of food on your plate, but the rest of the plate is empty, and it's not looking very rosy in that sense. Yeah. So people are going to need to still take all the precautions, wear the masks, do the distancing. Don't get together with people from outside your own household at Christmas. I know a lot of people are going to be tempted. I know it's probably going to happen, but it's not a good thing because that could lead to further pressures on the hospitals. So everyone's going to have to keep minding their pandemic precautions. The experts are saying for quite some time, because until all of us are protected with the vaccine, in a sense, none of us are protected. So just because people get the vaccine doesn't mean you're not going to have to wear a mask, because, we don't know, as we said, whether you can still shed and spread the virus. So these precautions are going to be in place for months. Maybe we can breathe easier under our masks, but we're still going to need the masks.
Rob, thank you for taking the time to talk to us.
It is my pleasure. It's a fascinating subject. Thank you for having me on.
That is Rob Ferguson, veteran provincial politics reporter for the Toronto Star. Rob has more reporting on how the Ontario government is responding to COVID-19 and the details on rollout plans as they happen on thestar.ca. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.